to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
So did everybody have a chance to review the minutes?
So moved. Second.
Second, all in favor?
Aye.
Carries.
HE1 is a resolution requesting a budget modification for the cost spraying to control disease-carrying mosquitoes. This year, we detected the virus that causes triple E in multiple pools of mosquitoes in the Big Bay Swamp area of the county. The state declared an imminent threat to public health for this area. Steps were taken to initiate a program of spraying to significantly reduce the population of mosquitoes. We would like to increase environmental other fees and services to $38,349. Article 6 reimbursement will be $19,175, and we're requesting the remaining $19,174 from the appropriated fund balance.
Any questions? Okay, so just in case we've got someone that doesn't know what happens or the way Oswego County does this, if we put mosquito spraying in our budget, we pay bill. If we do not put them in our budget and the state declares a state of emergency upon request, they pay half. So this is usually an annual thing, so we have to shuffle the money around to cover the cost. We are working at NICEC to try to get the state, now that everybody is getting this all the way to the coast, cover the bill. The bill's the bill, just pay the bill. So that's the way we do it. Yes, Frank?
Will we be sending out a flyer to the innocent mosquitoes so that they may leave the area, so that we just get the affected ones? I'm tired of the, collateral damage here to innocent mosquitoes.
Are you getting calls from these mosquitoes?
Sending me letters every day saying, "Oh, what's going on?" Doing an excellent job.
That, ladies and gentlemen, is why we never let Frank go to another committee. Thank you, Frank. Okay, have a motion?
So moved.
Second?
Second.
All in favor?
Aye.
Opposed? Again,
HE2 is a resolution requesting a budget modification to cover the cost of preschool services. The 3 to 5 preschool special education program is mandated through the New York State pursuant to the Individuals with Disabilities Education Act. While Oswego County has seen an increase in the total number of children who receive these services, that we're not seeing an increase in the total number of children. Not seeing a total number. We are seeing an increase in the level of services needed and the locations of where these services are provided. Through July of 2024, we've seen a 27% increase in the total number of children receiving center-based services and 60% increase in the tuition expense. Tuition for center-based services is costly and is set by the state. The only center-based provider in Oswego County has a 24-25 rate of $48,244, and that is for a 10-month program through the school year, September through June. In addition, there is a 2-month summer program through July through August with a tuition of $7,952. Together, this is $56,196 per child for a full year of service. Health is requesting an additional $1,484,725 to pay for the service costs through the end of 2024. The amount is based on the 24 average monthly expenditure of $444 $247.
It's okay.
We are requesting the funds for to increase $883,411, and that will be from state reimbursement. $121,708 from vacancy, and then the other $479,606 from the appropriated fund balance.
Have a motion?
So moved.
Second? Go ahead.
Vera and I spoke about this at length yesterday, and I also spoke with Phil on this also. Vera, could you just explain, because I didn't know this, and shame on me, but it never came up. Could you explain how these children, and how it's determined through the school, and who makes the determination where these kids go? Because there's 6 centers. You explain it. Please explain the whole thing.
Can I defer to Krista Foley? She is the Director of Children with Special Health Care Needs.
Are you related to Mike? Okay.
She's the director, and she also ran this program for several years. So I did bring her in today to answer any questions that you may have.
Welcome to the committee.
Thank you. So the children that are in preschool services are referred by their parent to their local school district. Once that referral is made, the child has evaluation by a team that's approved by state education. Following completion of the evaluation, we meet at committee. It's the Committee on Preschool Special Education. There are several professional providers on committee, as well as a chairperson from the school district. We have a county rep on committee, and those that perform the evaluation. It's there that they determine the service that's going to be needed, the frequency that it's going to be provided. That's where we decide if the child's going to go to a center-based program or if they're going to have services delivered by another means. It is parent choice. We are contracted for reimbursement purposes and payment purposes with several providers in county and out of county. But ultimately, once it's determined that a child meets eligibility and the recommendations are made, it's parents' choice where that child's going to.
So just so you're aware, because I was shocked when I heard this. Correct me if I'm wrong, there's 6 different centers that these children can go to. Is that correct?
We have one program in our county,
Correct.
and then we have several outside of our county.
All right, and who makes the determination where this child goes?
The committee that meets based on eligibility recommends the services. We provide the parents with options, and then it is up to the parent to decide what center they want to send their child to, and that's also based on if the center has capacity.
All right, the reason I bring this up is I know I get that, because we're told to by. Also know from what I was explained to me, this program's been around since 1960.
They started it in 1960 and it became public health law in 1974. And then they expanded it to the early intervention program in the 1980s.
All right, so it's been growing and growing and growing. And again, I understand, it's nothing against this. I mean, there's needs, I get that. But the school district should be doing this. The school district should be funding this, where it's open and out to the public so they can see it. That's my issue with this, because we're paying the taxpayers on it, but we have to make the determination of saying, yes, take it from taxpayers. But it's buried in our budget. Where a school budget is a lot simpler than ours, by light years. And that's my issue. The school makes all the determination. We've got a representative there, but I'm sure we don't have a vote to. Yeah, we sit there like, yep, correct me if I'm wrong.
Correct.
Okay. That's my take on it. The school should be completely doing this and should be under their umbrella. It's under their umbrella anyway. Let's be honest about it. we don't have a say to do anything about it. That, I'm sorry, I'm into open government all the way.
Anybody else?
Yeah, of those 6 facilities, how many are in this county? One. If that's the next one.
I'll have some more information, but it's going to tie into the next resolution, so I'll hold my comments and conversation with that. Any other comments on this? Need a motion?
Also moved.
Second. All in favor? Opposed? Thank you.
HE3 is a resolution requesting the approval of a budget modification to cover the cost of preschool transportation. Transportation needs and costs continue to increase. Through July 24th, transportation is up 29% from 2023. An increase in costs was expected and budgeted, however, the actual costs are trending to exceed the original budget. This is due to the increased number of children requiring daily transportation out of the county to center-based settings. Transportation costs qualify for state reimbursement at 59.5%. Help is requesting $884,400 increase to the preschool transportation. This is offset by $347,718 in preschool state aid, $100,498 from vacancies, and the other $136,184 from the appropriated fund balance.
Need a motion?
So moved.
Second.
Second. Any discussion? Okay. This is a priority for NICEAG. So anybody attending there is going to hear about this. You know, we're very fortunate that the vice chair of NICEAG is Phil. And he and I have talked at length about some of this. Phil has made this a priority with the board of NICEAG, that NICEAG needs to be involved. Where exactly the money should go, I think has still got some questions. Most of the people that I've talked to that are on the Children with Special Needs Committee, which I am on, and I'm going to be taking these resolutions that we dealt with today, and the information you gave us in the back of that, I think you got information in the back of this. That's going to be given to every board member on children with special needs. So the majority of people agree with you. This is a school issue. It should be in their budget. And then the state should provide the budget to the schools to cover the cost, because county does not have a decision in where the child's going. The school and the parent, school kind of influences that, the parent makes a decision. So, you know, it's getting worse. And it is one of the challenges that Phil is dealing with in the 2025 budget. I just put you on the front page and said you were going to be talking to the board about the
Yeah, it's on the board agenda.
Yeah, so we're going to take up the fight. Oswego County is not shy. We've done that several times with things with NICEAG and been successful. So we're going to take up the argument. I'll take it up with Children with Special Needs and Public Health, Mental Health, and that committee if I have to. Phil's going to take it up. And the hopes are that transition goes the way it does. Next year, Phil's in charge of the board of NICEAG. So if we get this in there and get it started, we might have some success in pushing this. Can't make the state vote the way we think, but we can certainly get some people on board that understand what the issue is on the local level.
It's not just our county.
Right. And I deeply appreciate that you're here. You looked a little shy. I wasn't sure if we're not a mean committee. Go to Ways and Means, knows make an argument. This was pretty easy. We're all supporters of that. You know, so is Isabel. So, but we are going to take this issue. Anybody else want to comment?
I just have a question. How do we break down transportation? Who handles the transportation? Who's the 584,000 going to?
Durham Transportation. Some of it is parent transportation, but most of it goes to Durham.
So
It's
why
our
are,
contract agency.
why are we supplying parents with the transportation?
That's part of the
I mean,
law.
the funds.
So if they decide to drive their child
They get reimbursed
first, yes. and
per
we pay
mile?
them.
Is that how that works?
That's correct.
Now, so Durham is the bidder on that. Now,
That's correct.
when does that bid go out, or how does that happen?
It's just got Rio.
Correct, and they were the only respondent.
And were they the only bidder?
That's correct.
That's the problem. And that's a problem in rural counties, is that a lot of times it's what's happening. I already knew that, I just wanted you to say it.
Was it because of a lack of people to send a bid to, or?
There's not, nobody does it. Okay. It's a specialized, they gotta have aides on the bus. And that's part of the problem with this. We're in funding piece of it. It's not about, is the money wrong? What's wrong is who's paying the bill. This is an educational issue. It is a health issue that it needs to be dealt with, but it's the education that are making the decisions. They're making those decisions at a great cost to them, as to everybody else. Right?
Yeah, there's no accountability for the finances for their decision. They don't bear it. We have no say in the selection of the eligibility of the children. We have no say in where they go. We have no say in the prices paid to the centers, the centers. It's all the decision making is removed from us. We just have to pay the bill, what everybody else decides. It stays safe.
Any other comments? Okay, need a motion?
So moved.
Second.
Second. All in favor? Aye. Opposed? Thank you. Good. Now the handouts.
Now the report.
By the way, Frank, when I got home, I asked Pat about that for the days and nights of it. And that was my son that asked me up. He thought that I could be there for my birthday thing. But she had it right. And I knew she did because the suitcases are already upstairs.
You know, they were there.
Okay, so that's probably,
If you want. I have an extra.
Because I wasn't there. Just.
move some things around, and then yesterday, my life became very simple because the Arise budget went to hell in a handbasket, and they walked 6 of us out of the organization, so I'm retired. But I'm 72 and we're okay. I just, I was never going to pull the trigger for that anyway. Somebody else had to push it out the door. It is too bad. It would have been nice for them to say, look, at the end of this fiscal year, we're not going to reestablish that position. So I'm getting used to it, and it's not going well so far. This is day 1 of full retirement. Yeah.
So I did
you're up.
do your handouts, the overdose prevention division updates. You need to see our overdose incidents are down from last year, which is wonderful news. I'd like to believe that we have a lot to do with those numbers being down. At the health department, pushed out Narcan, doing education and training in our community. I also sent you the environmental data. So free if you have any questions. So I do my director's report. We're continuing mosquito surveillance with no end date set yet. We continue to see positive pools of virus-carrying mosquitoes, both Triple E and West Nile. These are coming in weekly. We did have one horse that went down in Richland back in July, and they passed away from West Nile virus. We are continuing our messaging and education on personal protective measures to the community. In the fall, the numbers of mosquitoes will start to drop. It is important time to remain vigilant. So there's still the disease out there. Remain vigilant. Personal protective, the key messaging. We are working with the school districts to hand out bug wipes for sporting events and other outdoor activities. I'm in the season, we're not ruling out anything at this point, which includes we may have to spray again. Hopefully not, but we're not ruling it out. We are keeping an eye on the weather, and we're also looking and watching for shifts in location from where we're getting the positives. So as long as the mosquitoes stay in a certain area, that's a good sign. If they start moving out of those areas that we haven't seen positives yet, that's when we have to take notice. Also, how mosquitoes act, and they change their habits as fall is upon us. So they're going to start eating more vegetables, I should say, instead of trying to get the blood meal, which is a good thing. And that's how they will lay their larvae and go through the winter months. So we're hoping to see that. They call them green mosquitoes. We're hoping to see them very soon. I have my toes, fingers, everything crossed that we'll have frost soon, because this has been. I'm so ready. I know no one else is, but I'm ready. I'm hoping for it.
You know, it's unfortunate that sad events and tragic events have finally brought that to national attention. It's too bad that people would listen to counties that have been dealing with this for years until this year. And now there's been a few people die in other states that are standing there with blank expression of like, how did this happen? I had this problem, this different issue. Was there also another horse in
There's
Cayuga County?
16 horses,
16?
16 throughout upstate.
Upstate, okay. 2 in Cayuga?
Two,
Yeah, I thought.
10 counties, 10 counties, 16 horses.
That's unbelievable.
That-
Where we were to where we're headed. So,
We usually see around 5 or 6 horses, so 16 is a huge. So that makes us even more vigilant, and our messaging is really important. Weekly beach sampling has concluded. We did have many high samples of the harmful algae bloom, so we had to do repeat samples throughout the year, and that's usually due to the high, heavy rains and winds that we experience. We did have one beach that had to stay voluntarily closed for harmful algae bloom. That was August 15th. Once the bloom had cleared, we went and they were allowed to reopen like the next day. We had several non-permitted waters also report the harmful algae bloom this summer. It's not something that we monitor, but we did get reports of it, so we did put out a press release on that. It's the most we've ever seen in the last several years. Children camps, we continue to see issues with the certifications that were present again this year. We are trying to figure out a way to resolve these issues. Last year, we did try to get the messaging out earlier to resolve some of these issues, but we're looking at developing a new system on how to deal with that. Super Dirt Week meetings are underway. The event is happening October 5th and 12th. The next meeting is held for scheduled for September 8th. Several fall festivals are coming up, and we're dealing with the influx of the temporary and mobile food service vendors applications. On August 7th, we held a rabies clinic at Bristol Hill, where we vaccinated 114 dogs, 42 cats, for a total of 156. Those numbers are way down. We believe it's due because we had the clinic in the city of Fulton.
Numbers were fantastic.
And those numbers were fantastic. There's no doubt about it. Our next scheduled clinic is for September 18th at the Parish Highway Garage. Public health education and emergency preparedness. We have some upcoming classes at the health department. Chronic disease self-management started August 27th and will go through October 1st. Stepping on will start September 25th, and we're taking applications for that right now. So if you know anybody, please send them to the website to sign up for that class. And diabetes self-management class will start October 10th. Our year 12 performance incentive program is complete. Turned in all of our documentation. We continue to partner with the city of Fulton in increasing physical activity throughout the city. We've partnered with OCJ, our jail, to distribute Narcan at the time of release of the inmates, and that program is going great. No issues there. We're already getting calls to book vaping presentations at all the school districts, so that is wonderful news. And we're working on the new deliverables for the public health emergency grant. Healthy Families program. Healthy Families is above capacity at 108%. We are placing families on a wait list now and unable to admit any more into the program. At this point, we have 15 families that are waiting. On July 24th, we had our first site visit from the Office of Children and Family Services. Everything went very well, and we were free of any deficiencies, which does not happen. So very proud of my team for that. We're still waiting to hear about the Child Welfare Protocol Program. This is a program that, if approved, will allow us to increase the age in which we can accept a family by working closely with the two departments in social services, Child Protective Services and Family Service Prevention Unit. We're hoping that they will consider Oswego County, and that will help us increase our capacity and funding for that program. Our team is planning a fall harvest for the families in the program, and we're also working with the Angel Tree Project. Preventive and LICSA program, maternal child health, remains busy. Our roster is consistent with 25 to 30 babies. Communicable disease surveillance, we continue with our routine investigations. Lyme and COVID numbers continue to rise. We do have a new respiratory dashboard on our website, so please everyone check it out. It is really neat. Our preventive epidemiologist put that together, and it's a wonderful dashboard and has a lot of great information about all the respiratory diseases. But it's consistent. We're following 123 children. Immunization clinics are very busy. We're holding several after hours and off-site clinics to accommodate for back to school. We are starting to schedule for flu clinics. We should have the new flu and COVID vaccine ready to go for October 1st. So more information on that. Children with special needs, I'm just going to read your report. Preschool, 32 committee on preschool special education meetings were attended. Staff is coordinating and finalizing transportation requests for the start of the new year. 64 bus or parent transportation agreements have been made. Early intervention, we have 18 referrals received in the month of August. Staff has finalized transition dates and times with school district staff and families. 49 cases are scheduled for transition. Children and youth with special health care needs, parent packets for expected and new parents have been delivered to the local OBGYN and pediatrician offices. These packets include division program information as well as other health department information. That includes lactation services, maternal child health visiting program, safe sleep, car seat inspections and distribution, immunization clinics, lead prevention, and information about our Healthy Families program.
Maritime? Nice, thank you. I do want to follow up that I had heard several times, and then again, Fulton was kind enough to thank the county for the babies clinic. But they had said that next year they really want it back and try to find a way to even increase the numbers. If you look at the list, they tied with animals. Those two probably should have automatic carryover to make sure that we're getting the number of shots out that we need to get out. I realize this becomes a little bit more territorial. We're just ready to set that schedule. But at the same time, it's about the number of animals that we can get vaccinated. So, congratulations. Also, I know that you're not directly involved with it, but the water chestnuts, both of them, this is the fourth year in a row that they've dealt with them. And this is the clearest that river has been in years. They still probably need another year, and then maybe they can go every 2 or 3 years extra. All of the people down there that do boating and everything else, they're very grateful that the county has done this and cleaned up that water. Anybody in the committee got questions or comments? Frank, go ahead.
Fall festivals. The Bolton Fall Festival, is that on your list of?
I'm sure it is. If they have food vendors, I'm sure.
Okay, the reason I'm asking is, what's the number for mass, you said that the guideline is in order for certain criteria to be able to consider it a mass.
Mass gathering,
Mass
and it has to be enclosed. So they have to have a gate with an in and out.
Oh, all right.
So like Harborfest is not considered a mass gathering.
All right.
Super Dirt Week is different.
Okay.
So most festivals are considered.
Then I'm all set. Thank you.
Okay. All right. So stepping on class, they got a great speaker that's going to be there again this year, talking about falls prevention. And I can do that without leaving my schedule around. Is that it? Any other questions, business? Bill, you good? So, all right, motion please. All in favor? Thank you.
Thank you.